Coming right up, a special edition of Straight Talk focusing on SCAN Health Plan. Our guest tonight, SCAN President, CEO Chris Wing, and SCAN founding CEO Sam Ervin, as we continue our 25th anniversary year.
Closed captioning provided by SCAN Health Plan. Straight Talk is brought to you in part by Southern California Edison. For over 100 years, life powered by Edison. The Press Telegram, your local news leader for over 100 years.
Join us for tonight's edition of Straight Talk. And now your host, Art Levine.
Good evening and welcome to Straight Talk. We have a great show for you tonight focused on SCAN Health Plan. Our guest is President, CEO Chris Wing. Chris, welcome back to Straight Talk.
Oh, it's my pleasure to be back. Thanks.
This year you are celebrating your 35th anniversary of SCAN. You have this lovely brochure kind of focusing on some of the accomplishments over the years. What is it like, 35 years and going strong?
Well, I think the mission and vision that was constructed by our original founders, the 12 Angry Seniors, is alive and well, and I expect it to be our mission and vision 35 years from now.
Just for those viewers that are not familiar, tell us what SCAN, which is an acronym for Senior Care Action Network, what does SCAN do?
Well, our mission is to help seniors maintain their health and stay independent. And independence to us means staying out of nursing homes, if at all possible.
And provide certain types of benefits unique for seniors.
Yeah, we're a Medicare Advantage Part D plan, so all of our members have to be seniors and they have to be Medicare eligible.
And they will assign to SCAN their Medicare benefits, and in return they get what?
They get a great experience. They get great customer service. They get the services from 1,200 employees who are there for one reason. We don't have Wall Street to support. We're here. The seniors are our bosses. So that's how we measure success.
And I know that you poll regularly user satisfaction, member satisfaction, as you call the enrollees, and it comes out very high.
Well, this year we got surprised. Medicare did a polling last year, Art, and we said 2 years ago, we set out to prove that SCAN was going to be one of the best Medicare Advantage plans in the United States, and we were going to measure that success not by market share. We weren't going to measure that success by profits. We were going to measure that success solely by customer satisfaction. So for the 2013 annual election period, Medicare published in their Medicare New Booklets the overall satisfaction rates for each and every MAPD plan. And the best in California is Kaiser. God bless Kaiser. 91% of Kaiser's members were satisfied with Kaiser. SCAN came in, we were tied for number 2 with Inter Valley, but only 1 point behind.
Really?
90%.
90%.
So Kaiser is really good, but Kaiser should be looking at in the rearview mirror because we're coming on strong. They set a great example, they're a great competitor, but we are set out not to tie Kaiser, we set out to beat Kaiser.
And that polling was done, as you said, by Medicare, not by
Not
SCAN.
by us, not by us.
It kind of reminds me of J.D. Powers in cars and other fields. It has a lot of confidence when an independent polling agency is doing the polling.
Sure.
Yeah. Well, you mentioned you're not concerned about Wall Street. By implication, bringing up the fact that SCAN is a nonprofit. It always seemed to me, whether it's a hospital or other provider, it gives me some comfort to know that I'm going to a non-for-profit entity rather than something run that has a responsibility to shareholders. Now, I know you've worked for-profit as well, and you have some nice things to say about that, but just one man's opinion, I like the idea that you guys are nonprofit.
I think there's a difference. We don't have to think quarterly, we can think in terms of years. Also, it's nice to know that we're here purely to satisfy seniors. There's nobody else that's our primary stakeholder.
And we're going to speak with the founding CEO, Sam Ervin, in the next segment. But SCAN was early in on this whole field.
Well, we were founded 35 years ago, and we had a very unique mission vision to help seniors manage their health and help seniors stay independent. The mythology, which is true, is that SCAN was founded with Sam as the founding CEO and 12 angry seniors who were based here in Long Beach, who were very unhappy with the care being rendered to seniors who were ending up in nursing homes that didn't need to be there. That resonates very personally with me, as when I was a young man, we had to put my dad in a nursing home where he withered away for 4 years.
And I remember on an earlier
Yeah.
show you mentioned visiting him each weekend, actually.
Every Saturday morning for 4 years, and it was
Wow.
the most painful time because he just kept getting strokes and so forth. And there's a place for nursing homes, but if we can keep one person out of a nursing home, maintain their dignity, their social, and oftentimes you can do it just with a little bit of help.
Yeah. And there's less cost to the system because nursing home care is far more expensive than the additional at-home care that you're able to provide.
Last year, Kaiser Foundation reported that 13% of American seniors who are living in nursing homes consume 30% of the total Medicare spending. And that doesn't include the state spending on the residential care, the board and care for the long-term care, for the nursing home itself, which could be up to $6,000 to $8,000 a month. So what could be more noble than to keep seniors out of a nursing home when they can be kept safely in their home or in the community? And we're all talking about how do we reform Medicare? You can't reform Medicare without reforming the flow of seniors in nursing homes.
Wow. So you improve the quality of life of the senior by keeping them out of the nursing home, and you reduce the cost to the whole system collectively because it's much less costly to provide these additional services at home than pay the monthly nursing home fee.
That is correct. What a novel concept.
Wow. You mentioned Medicare and Obamacare or health care. We'll talk about this later in the show, but there are a lot of elements of this that need to be finalized, are there not?
Well, I think there's 1,500 pages. The original statute is being challenged and interpreted, and it goes into effect, 7 months from
Wow.
day before yesterday.
Wow.
But I think there's some very noble elements of healthcare reform. There's the way it got constructed, very partisan in nature, but there are some very noble precepts as far as the triple aims of healthcare: improving quality, improving service, and reducing cost. We believe in those, and I think the Obamacare in 10 or 15 years, we'll look back and we may continue to debate the effectiveness of the policy itself, but I don't think we will debate the fact that it provided the impetus for the healthcare system to reform.
Amen to that. And in the next segment, we will meet a true icon in this field, the legendary Sam Ervin. Stay with us.
Supported by Edison International. Californians are getting to be old hands at year-round energy conservation, part of our special awareness of the resources we all depend on. We're making the change to energy-efficient light bulbs, keeping warm weather thermostats set to a comfortable 78 degrees, and giving major appliances the afternoon off. Because when it comes to energy conservation, it all adds up. Life, powered by Edison.
In today's world, everything's connected. From the workplaces that support us, to the homes that welcome us, to the trees and wildlife habitats that remind us how important our environment is. When a bird lands on a branch, and in the midst of a busy day, we stop to watch, it makes us realize we're all in the same boat. The Port of Long Beach welcomes this world with open arms, an environmental policy that's second to none, and a commitment to shaping a vibrant community. The Port of Long Beach, thinking outside the docks.
Hello, I'm Jessica Hardy, a proud Long Beach native and a member of the USA Swimming national team. Having spent much of my life in water, I've developed a deep appreciation for the valuable role that this precious resource plays in our lives. In recent years, California's water supply has become unreliable. To address this reality, Long Beach residents have dramatically reduced their water use through permanent lifestyle changes. In doing so, Long Beach has made itself a leader in water conservation. As I work hard to achieve my personal goal of qualifying for the 2012 Summer Olympics, I encourage you to continue your tremendous efforts to use water in smart and responsible ways. So join me and your fellow Long Beach residents in strengthening the water conservation movement. By making small but significant changes in our water use habits, together we can ensure that we have a reliable water supply for many generations to come.